I want to share with you some information that could be the difference between you walking out of your house one day. And that's going to be really important that you listen up, because it may not apply to some of you in the room, but it could apply to people that you know. There are places in the country where if you come in with this disease and your skin is brown, you may receive care that is different from someone else. The issue is so profound, the care that you receive may lead to your early death.
Saving legs, changing lives. It's our pleasure to have Dr. Jabaris Swain, a world-renowned cardiothoracic transplant surgeon, scientist, and global health scholar, joining us. His work focuses exclusively on augmenting access to clinical education and care delivery for cardiovascular diseases within resource-limited settings, places like Rwanda and Haiti. He has lived in these areas and provided support to projects designed to strengthen healthcare infrastructures for critically vulnerable populations in resource-constrained settings. Please welcome this afternoon, Dr. Jabaris Swain.
Good afternoon, Harlem. Good afternoon, Harlem. Excellent. My name is Dr. Jabaris Swain, and I bring you greetings from Philadelphia. I actually got on the train this morning, really excited to be here with you all. So if I can just get your attention, if I can at least just get your attention for 15 minutes, I want to share with you some information that could be the difference between you walking out of your house one day. And that's going to be really important that you listen up, because it may not apply to some of you in the room, but it could apply to people that you know. And so we had a great conversation earlier about cancer, about advocacy, about knowing your numbers. But one other thing that is important is that we have access to medical information. And part of the reason why I'm here, I'm joined with some of my colleagues from Research Includes Me, My Health Can't Wait, and Johnson & Johnson Innovative Medicine, because we are committed to making sure that people of color and anyone who has lived within the margins of healthcare receives appropriate education to be able to advocate for yourself. And so today I'm going to talk to you about a disease that many of you probably have never even heard of. But I'll promise you that of every third person in the room, at least one person has this disease, or you are at risk of developing it. And it's called peripheral artery disease. Now, we've heard a lot before in the past about coronary artery disease, and as a heart surgeon, that's really important to me. But peripheral artery disease is equally important because it involves the vessels that carry blood from your heart to the rest of your body. And so I'm going to share with you some information that's going to be critically important, not only about the fact of peripheral artery disease, but the fact that there are places in the country where if you come in with this disease and your skin is brown, you may receive care that is different from someone else. And not only that, the issue is so profound, the care that you receive may lead to your early death. And that care that I'm referring to is called an amputation. And so the goals for my talk today, I'm going to talk to you about peripheral artery disease. We'll go over really quickly about what it is. I'll discuss with you why it's important for Black Americans specifically to understand this disease. And then I'm going to try to give you some tools to understand how you can protect yourself moving forward. Anybody here who identifies as Black? Anybody besides me? Because if you do, while it is an awesome opportunity, it puts you 2 times greater risk than white Americans for developing PAD. And so what is PAD? We're going to start with a basic anatomy lesson. So we have arteries. Arteries are the pipes that carry blood from your heart to the rest of your body. And so when there's an issue with the arteries, you can have buildup. And if that buildup happens in the heart, it's called a heart attack. And we commonly know that buildup as plaque. But plaque can occur not only in your heart, but it can also occur in the blood vessels that supply blood to the other parts of your body. And so PAD occurs when a plaque builds up and forms in the walls of the arteries that supply blood to your limbs. And so we know what happens if you have a clot or a plug when blood goes to your heart. As I mentioned, you have a heart attack. If you have a clot or a plug that prevents blood from going to your brain, you have a stroke. But what people sometimes forget is that you can also have a clot that goes to your extremities, primarily your lower extremities. And the way that we manage that, as I mentioned, can be very different. There is a percentage of Americans who get to the health facility too late, and we're unable to do anything. And the treatment for PAD in that case is amputation. And so, as I mentioned, when you have the blocked arteries going to your heart or your brain, we know about those. But what about when they go to your legs? And who's at risk? Anybody have diabetes? You don't have to raise your hand, but if you have diabetes or know someone who has diabetes, they have a 1 in 3 chance of developing PAD if they're over the age of 50. If you have heart disease, you also have a 1 in 3 chance of developing or having PAD. And then here's the one that is no stranger to our community, high blood pressure. Some of you may say, well, I don't have high blood pressure. Well, if you're taking metoprolol or any of the alls, it's likely because you're treating hypertension or high blood pressure. There are also a couple of other medications. But if you have high blood pressure, that is a condition where your top number is greater than 130 and your bottom number is 80 or above. If you fall in that criteria, you are at a higher risk of developing peripheral artery disease. So it's one thing to have hypertension and have to take medications, but then it's another thing to have not only hypertension, but also to be at risk of PAD. And my goal today is to try to help you learn ways to minimize that risk. And then the next one a lot of people are probably familiar with is hypercholesterolemia or hyperlipidemia. That's the name that we use in the medical terms. But high cholesterol can also put you at great risk of developing peripheral artery disease because it can lead to the formation of plaque. And when that plaque forms, it can cause you to be at risk for developing a heart attack, a stroke, and diminished blood flow to your extremities. And then this last one, we don't really like to talk about it, but it's been in the news a lot, and it's obesity or being overweight. One thing that draws our community together is food. And I know that I am standing between you and food right now, so I'll try to go quickly. But what's going to be critically important is that we watch our weight. It's not a matter of going on a diet, but making sure that we're eating clean, that we're optimizing vegetables, and that we're minimizing the things that are going to add weight to the scale. And so these are some others. I won't go through one by one, but these are some other conditions that can put you at risk. Chronic kidney disease, if you smoke, that also includes Mary Jane. If you have a family history, a family of peripheral artery disease, if you're older in age, and if you're Black American. Again, Black Americans are 2 times of greater risk of developing peripheral artery disease than white Americans. And so what do we do about it? What are some of the signs? I have up here some signs and symptoms, and many of you probably even have these symptoms now. painful leg cramping, numbness, weakness, and heaviness in your legs or feet, resting leg pain, cold feet, discolored skin, hair loss in your arms or legs, or foot sores. And what's also important is that 40% of people with PAD, they don't have leg pain. And so treating it in time may protect you from serious conditions like amputation, such as loss of your leg or foot, heart attack, stroke, or death from heart attack or stroke. Untreated peripheral artery disease can affect your daily living. You'll struggle with simple daily tasks, even walking, and it could mean a loss of independence. So how can you find out if you have it? Tell your doctor if anyone in your family has peripheral artery disease. And then the most important thing, which is what I've done now, I've taken my shoes off. I won't take my socks off because I want you to leave here remembering that anytime you see a health provider and they do a full physical, make sure you take your shoes off, take your socks off, and then have them examine your legs and your feet. All right? And if there's a concern, your doctor should take your blood pressure in your leg as well as your arm. And a lot of people are like, well, wait, I always get my blood pressure checked in my arm, but you can also get a pressure checked in your leg. And when we capture those numbers, we create a ratio called ABI, ankle brachial index. And what that does is it gives us a number that will let us understand whether or not you have peripheral artery disease, or if you are at risk, or if you have diminished blood flow that requires further attention. And there are some other tests that you can get done. There's some blood tests that we now offer that not only gives us an understanding of your risk for peripheral artery disease, but also coronary artery. There's also imaging that can be done, which includes an ultrasound, which is non-invasive, which means they don't have to go inside of you. It doesn't require surgery. They just put the probe on your vessels to be able to understand how well your blood flow is. It is going to be important for you as patient advocates, if you have any of those symptoms, demand that your doctor examines your legs and your feet. And if there's an issue, demand that they do an ultrasound. And so, if you have any of these issues, and I'm sure there's somebody in the room that has these conditions, wounds on your toes, feet, and legs that are slow to heal, unexplained pain or cramping, skin discoloration in the feet, poor nail growth, skin that appears shiny, or loss of leg hair. If any of those are conditions or concerns that are plaguing you, make sure the next time you go to the doctor that you take your shoes and your socks off and have them examine your legs and your feet. Next slide. And remember, 40% of people with PAD will not have leg pain. So there are some of us who have peripheral artery disease and don't even have symptoms. Next slide. So if it is found that you have peripheral artery disease, it's not the end of the day. And that's why it's important for us to detect this early, just with everything else. There are medications that can be given and other activities that can be done that will either minimize or reduce your risk from going on to amputation. And that includes medications that help lower your blood pressure, medications that lower your cholesterol, medications that prevent blood clots, and help leg pain and improve your walking ability. And it doesn't always have to include medication. I know there are those of us here that also like using natural remedies and homeopathic remedies. Whatever your kind of etiology is, the important message that I can endorse today is making sure that you see a provider and that you're screened for peripheral artery disease. And so really quickly, I'm going to wrap up and share with you some other ways in which you can reduce your risk. And the first one is a no-brainer: be more active. Walking and or getting exercise is important. A doctor or physical therapist can help you develop a plan. Not all of us can get out and run or jog or do like swimming exercise, but even those of us who are in a wheelchair or seated, there are simple exercises that you can do to help minimize your risk of developing peripheral artery disease, as well as lower your risk of developing other cardiovascular complications. The next thing that we can do is quit smoking. I know that's easier said than done, but if there are challenges, there are different programs and medications that we can use that will help minimize and reduce the amount of smoke intake. And not only if you're smoking yourself, but you can also be at risk if someone in the household smokes. Eating a heart-healthy diet. And so, for me, I've chosen not to eat bread and minimize my carbs, and you may have a way in which you're modulating your own diet. Whichever it is, you want to try to optimize fruits and vegetables. And you want to be careful which types of fruits you take if you happen to have diabetes. But the most important thing is to eat a heart-healthy diet that is low in saturated fat. And then the last thing, take care of your feet. And that doesn't necessarily mean going to get a pedicure every week, but making sure you're examining when you get out of the shower. Don't just air dry your feet. We need to get a towel and dry your feet. And then the last thing, sometimes we hear about, athlete's foot and foot fungus, or you have a friend that takes their shoes off and it has a foul smell. If you have those conditions or issues, we need to get it checked out. All right? So I'm going to wrap up here, but I want to just thank you all for your undivided attention. And I really just want to reiterate that Johnson & Johnson Innovative Medicine, and we are committed to being in the Black community, and we are committed to making sure that we provide health care such that someone's background or their ethnicity does not dictate the care that they receive or deserve. We want to exist in a world in which all care is available to all individuals. But we can't do it alone. And we need your help. We need your help in advocating for yourself. We need your help in advocating for your family members. We need our partners here along the wall to remind our families and our communities how important it is to advocate for ourselves and our health. But most importantly, we need organizations like Black Health Matters. And so I want to give a final round of applause for Black Health Matters and the team for the work they've done. Thank you all.